Hi everyone, thank you for joining this next Cancer Research UK and Science on Google Plus Hangout on Air. Today we're talking about the links between processed meat and cancer, which came about in the wake of a recent announcement from the IARC, that's the International Agency for Research on Cancer, uh, as part of the World Health Organization. They announced that processed meat has been classified as a definite cause of cancer and red meat is a probable cause of cancer, which led to all the headlines you saw: bacon will kill you, burgers will kill you. But what exactly is the risk, and how do we and should we be giving up bacon and burgers? Is it really as bad as smoking? So to find out, we're joined by Dr. Kathryn Bradbury and Professor Owen Sansom. Hello.
Hi.
If you two can please introduce yourself and say briefly what you work on, then we can dive straight into the questions.
Okay, I'm Dr. Kathryn Bradbury. I'm from the Nuffield Department of Population Health at the University of Oxford, and I look at dietary risk factors of disease in large population studies.
Hi, and I'm Professor Owen Sansom from the CRUK funded Beatson Institute in Glasgow, and my lab works on trying to understand the early changes of epithelial cancers, particularly bowel cancer.
Do I get to introduce myself?
Yes.
I'm Dr. Katani. I'm Bedini's colleague. I'm from the Science Communications team at Cancer Research UK. And so if we kick off, I thought we'd start with you, Kathryn, because this is your area of expertise. You know, you're someone who studies how things in our diet are linked to cancer. How do we actually go about finding that out? How do you figure out what in all the different kinds of things that people eat actually increase their cancer risk? And how do we know that this sort of research is reliable?
Well, most of the knowledge we have about diet and cancer comes from these large population studies. So typically we recruit hundreds of thousands of people from the general population, and we ask them questions about their diet and about their lifestyle, and then we follow them up over many years to see who develops cancer. And then what we do is we look back, and so if we're talking about meat, for example, we'll look back and see, look at the people who said that they ate quite a lot of meat and compare them to people who ate less meat. And then we look at how many cases of cancer occurred in both kind of groups of people, and then we can kind of calculate the risk of cancer.
And this is about a risk, isn't it? It's not about saying, okay, you ate meat, so you got cancer. You didn't eat meat, so you didn't get cancer.
No, exactly. So we group people into categories, and then we look at in each category how many cases occurred, and then we look at the risk from that. And I mean, I think the main issue with these types of studies is that people who eat a lot of red meat, for example, or a lot of processed meat, they're also more likely to smoke, to drink alcohol, they're more likely to be overweight, less likely to do exercise. So these things also will give them a higher risk of getting cancer. So it can be a bit difficult to see if they have more cancer. If there's more cases of cancer in this group, it's a bit difficult to see whether it's actually the meat itself or these other lifestyle factors. So when we analyse the data, we're very careful and try to make sure that we take these other lifestyle factors into account. So we're trying to just look at the effect of meat on cancer risk, although sometimes it can be hard to completely rule out these other factors.
And in terms of the reliability of the studies, I mean, you kind of think, well, what did you eat 20 years ago? How do we know that these kind of studies are actually giving us reliable information about people's diets?
Well, in a lot of the studies, the questionnaires on people's diets, we have a lot of care was taken in the questionnaire when it was used to make sure that it is a valid tool, that it is really assessing what people eat. In some of the studies, I mean, it varies a bit from study to study, but in some of the studies, we also, well, in a lot of them actually, the diet information, we ask them about diet, not just at the start of the study, but numerous time points throughout, so that kind of information is updated as we go along as well.
So you're not asking people to remember what they had for breakfast 5 years ago. It's just, it's what are you eating now?
Yeah, so at the start of the study, we ask them what they're eating at that time, and then we follow them through time. And so we have to wait many years, really, for cases of cancer to develop, yeah. So it doesn't
And not,
rely on people's memory usually.
and not all meat is created equal, right? Because what exactly do we mean by red meat and processed meat? And what about things like chicken and fish? Where does that come in?
Yeah, well, red meat, so beef, lamb, and pork, those are your sort of red meats. There are other meats that we don't really eat much of in the UK, like goat or horse meat. Well, not intentionally anyway, should I say. And those are also counted as red meat. And then processed meat, that's meats that have been salted or cured or had preservatives added or smoked. So they're things like bacon, salami, pastrami, ham, sausages, beef jerky. And yeah, I think one of the confusing things when I've been talking to people, they think that mince meat, say mince pork or mince beef is processed. But actually, if you just buy that from the supermarket, it's not. It's actually red meat. It doesn't matter that it's been minced up. It's counted as red meat, yeah.
Yeah. And also, doesn't it matter how the meat is actually cooked?
Yeah, well, I mean, Owen might talk a bit about this, but in terms of the mechanisms of how it might cause bowel cancer in terms of sort of barbecuing or grilling at high temperatures, there are some compounds that can form then, which, might be important.
Okay, I mean, in terms of meat, so red meat, processed meat particularly, what sort of scale of risk are we talking about for these types of foods? For example, will one bacon sandwich increase your risk by a lot? What sort of actual scales are we talking about?
Well, the World Health Organization, when they did their recent summary of all the evidence, what they summarized was that an extra 50 grams of processed meat a day, which is about 2 rashers of bacon, so maybe what you'd have in a bacon sandwich, or 1 to 2 slices of ham. They said that an extra 50 grams per day increases your risk of bowel cancer by 18%.
I mean, is that a lot? This is my thing. Is 18% a lot? I mean, I don't know, Owen, as well. Have you got something to add here?
Well, I think when you think of 18%, it might sound quite a lot as an individual value, but if you think of it in terms of relative risk, it's still very relatively small. So I think we're not talking a massive increase in risk, which is why there's been so many studies over the years that have said, oh, is it or isn't it bad? And it's just because it's a small increase in risk that is the question. It's the problem, really. It's taken us a while to work it out.
And I guess it doesn't help when you get kind of difficult to interpret press releases from the WHO that fan these fires of misconception. So what do we mean by definite and probable? Because that was really interesting. Bacon is definitely bad. Burgers is probably bad. What do we mean by that? And they compared it to tobacco. So we know tobacco is a very clear link, definite cause of cancer. Is it as bad as tobacco?
Yeah, I did see a lot of misleading headlines. Now bacon is as bad as smoking, which isn't really right. So what the World Health Organization does is they put sort of components or put things like tobacco or processed meat into categories. So what they've done is said that processed meat is group 1, which is the same category as tobacco, and that means that they concluded when they summarized the evidence that there is enough evidence that it does cause cancer in humans. And red meat, there was a bit more uncertainty, so it's in group 2A that they think it probably does cause cancer. But in terms of comparing tobacco and processed meat, what we know is that, so they've said that they both do cause cancer, but the level of risk is much greater for tobacco. So we know that, we estimate that about 20% of all cancers in the UK are caused by tobacco smoking, whereas about 3% are caused by red and processed meat. That's our estimate. And if you look at sort of the number of cases of cancer a year, if you look at it this way, if no one in the UK smoked, we think we would prevent about 65,000 cases of cancer. Whereas if no one ate red or processed meat, we think we would prevent about just under 9,000 cases of cancer a year.
And it's still a reasonable number, but I think what didn't really come across in the news stories was it's the strength of the evidence that people were talking about rather than the size of the risk, wasn't it?
Exactly, yeah. Yeah, so they look at whether there is enough evidence that it does cause cancer. It doesn't matter by how much, you know. And so that's why processed meat and tobacco are in the same group.
So moving on a little bit, Owen, we heard all these stories, bacon will increase your risk of cancer. What kinds of cancer are we actually talking about? Because there's many different types of cancer.
Yeah, so there's many different types of cancer, and really the best evidence is for bowel cancer. So there's a little bit of discussions, and then if you look at the studies, there's a little bit of evidence that there might be increased risk of prostate and pancreatic cancer, and with processed meat, a little increased risk of stomach cancer, but predominantly all the evidence is bowel cancer. And I think the other studies are still relatively small in those other tumour types, which is why the WHO did classify that it's really bowel cancer that we're talking about here.
I think I did see a study last year that was looking at the link between red meat and breast cancer, and that didn't really seem to stack up, did it? I don't think.
No, and I think if you look across the literature, there are many different studies pulling out many different risks, and they can be quite different, and that often relies on the size of the study and how and when and where they were done. So I think we can say that for red meat and processed meats, they're really strong. Well, the links really are with bowel cancer and not really with any other cancers.
And how exactly does it? Sorry?
Does Kathryn agree with that?
Yes, yeah, no, definitely. I think you'll find probably red meat. There's a study about red meat in probably almost every type of cancer, but really the evidence really is for bowel cancer. There's a lot of studies on bowel cancer and red meat, and they do generally show the same story, especially when you pull them together.
So, Owen, I'm really curious about the mechanism, because how does red meat cause cancer? What's going on in the cells lining our gut?
So I think the thing here is also to, just as we know there's only a slight increase of risk with red meat and bowel cancer, one of the things that does mean is that when you try and understand the reasons why red meat causes bowel cancer, is that it's really very, very difficult to really pull out exactly why. So if you think of your bowel is where, this is an amazing tissue which turns over kind of every 3 to 5 days, and your tumor cells have to hold on. And also your bowel is then exposed to many different carcinogens. So what is thought in terms of red meat and processed meat is that you can increase basically your chance of carcinogens, so these N-nitroso products. So these can cause mutations to your DNA and probably might cause more mutations in some of the key colon cancer tumor suppressor genes. There's also roles for heme iron, which is in red meat, and this has been shown to be damaging as well. And
this is the kind of the chemical that's in blood that captures the oxygen, isn't it? That's the iron component of blood.
And so there has been a lot of suggestion that high levels of that can be bad for the bowel. And then there's other discussions, such as that we know that there can be just generally higher levels of iron might be bad and cause DNA damage and might cause mutations. And then the other thing that people have suggested is that we now know that in our intestine are many different bacteria. So therefore, what you eat could easily change your types of bacteria, and there are good bacteria.
This is the microbiome link and cancer.
Absolutely. So there's a whole number of mechanisms of which it can be, and if you go through and read papers, there are many different studies saying, oh, it's this component or that component. And so again, I think most people, if you were going to go for the, most evidence would be discussing about this heme iron or some of the mutagens in the meat and the processed meat. But really, there's still a lot to learn. Like I say, when you just have a small increase in risk, it's not as easy to work out as like with tobacco, for example.
Yeah, and you talked about tumor suppressor genes. So these are genes that normally prevent cancer, but when they're mutated, that means they can no longer prevent cancer. So cancer happens. Can you talk a bit more about that? So
if you think, so within the intestinal epithelium, there's kind of one key tumor suppressor called APC, and so this is the adenomyosis, I couldn't say, adenomyosis polyposis coli gene. So
I thought that it trips you up as well.
It's not easy being a scientist. We spend our lives but so basically this gene, patients that have one copy of this gene people will all develop bowel cancer, and then just as cancer sporadically occurs, you'll get mutations in this gene. And this gene then really is thought to be very important for the early initiation of colon cancer. And it's a very large gene, and there's lots of places where mutations can happen. So anything that causes the increase in the mutations of this gene, so let's say some mutagens in the colon, hitting that gene will then predispose you to cancer. And I suppose when we're thinking about something such as an increase in risk, we're generally thinking an increased chance of cancer initiation rather than cancer progression. Although I would say, again, we still really need to work that out a little bit more, but we would say that probably this is causing an increased start of cancer, and if you increase the chance of the start of cancer, you then increase the chance that that cancer will progress.
And it's also important to understand how bowel cancer starts, because that means you can develop better tools to catch it early. And early diagnosis is a big part of bowel cancer cures. And
absolutely, and also in terms of screening, so therefore, if you do have an agent which increases your risk of cancer, again, if you catch it early, and we now have the tests in the UK to check for bowel cancer, then you can just cut out those small early lesions, and then your risk then goes back to the same risk as the population. So I think that's the other thing to say, is that although we may be increasing risk, there's a lot of things we can do to stop this, and not, so therefore we can overcome this risk.
That's what I wanted to ask. I mean, perhaps Kathryn, if you talked about how many cases of cancer we could avoid in the UK if everyone just stopped eating red and processed meat. But I mean, bacon tastes good. Some people are vegetarians, they still get cancer. Some people eat lots of meat and they don't get cancer. But what is the best advice for people to cut their cancer risk from red and processed meat? Is it just to not eat it at all?
Well, I think you've sort of hit on things that, people eat not just for health reasons. So, there's a lot of things to take into account, what they like, obviously, whether they're willing to give up bacon sandwiches, as you said, price of foods, what their family will eat. So there's a lot of reasons why people do eat meat or don't want to eat meat as well. I mean, I would think if you think about how much processed meat you eat, if you eat it every day or nearly every day, then it probably is a good idea to think about cutting down.
And we have evolved to eat meat, because I know there are some people who say, well, we just shouldn't eat meat at all. But as a species, we have evolved eating red meat, certainly. Maybe not bacon, but definitely meat. And how does that fit into the picture? We do need sources of protein.
We do need to eat protein. Our body does require it. But actually, if you actually look at how much protein people on average are eating in the UK, they're actually eating more than what our bodies need. So yeah, I don't think generally people in the UK need to worry about getting enough protein. That their diets do usually contain actually a lot more protein than they need.
And Owen, you've talked about some of the mechanisms by which some of the components in meat, some of these chemicals, the iron, maybe these DNA damaging molecules, might increase the risk of cancer. Are there any ways that perhaps the effects of those chemicals could be reduced? I'm thinking, for example, in breast cancer, we have some drugs like tamoxifen that reduce the amount of estrogen in the body and help to cut breast cancer risk, that female hormone. So is there anything similar on the cards for bowel cancer and some of the products in meat?
Well, I suppose there's always been this discussion, and probably Kathryn can also comment on this, is that some of the earlier studies said that if you eat high fibre, that can sort of neutralise many of the effects of high red meat and high heme. So I think we can also think an idea of a balanced diet. So although it's not as targeted as trying to do, tamoxifen, so there is evidence of that. And then there's also good evidence that there's evidence that in terms of aspirin, but also some of the vitamin D, that there are also links in terms of colon cancer risks there. So I think we have to put this in the context of other studies. And I think one of the other interesting things is that we're also beginning to learn that individual people's risks might be different depending on their DNA, and so therefore they may carry other changes that might make them either have more or less risk. So I think what we're talking about here is a population risk rather than an individual risk.
And also, moderation and a balanced diet is so much more boring than miracle antioxidants. So I think you're shattering a lot of there.
Yeah, and I would agree with Owen that generally the studies, the population studies, especially when you pull them all together and look at them all together, they do tend to show that if you eat lots of fiber, that is associated with a lower risk of bowel cancer. So that's sort of one thing on the sort of protective side, I guess, that if you eat lots of whole grains and oats and wholemeal bread, then that might help you reduce your risk of bowel
And
cancer.
how exactly does that work? What's the mechanism for that?
Does Owen want to? I don't know.
Well, again, it's still trying to, people are still trying to work that out. So again, high fibers, again, you change your bacteria in the gut, and therefore, again, you're thought to have better bacteria that then break down and cause less damage. And there's also data about how quickly, if you imagine that if your intestinal epithelium, your small intestine on your bowel is a bit like an epithelial escalator, anything that increases the time or quickens up cells falling off might also then stop the cancers holding on. So there's a lot of work that increasing transit time and how long things sit within the bowel also reduces your mutation. So again, having regular movements can also be thought to be good, but there's a whole science behind it.
Yeah, I was going to say, I mean, without wishing to be too graphic, it is nearly tea time. But yeah, there's some pretty nasty stuff in the end product of what your food turns into, and I can't imagine that hanging around on the cells in your body is going to be particularly good for them.
I think there is evidence, and Kathryn probably knows better, that there is your transit time also seems to be quite important.
Euphemistically.
That's right.
I mean, I think that one of the things that always is difficult to talk about when we talk about diet and cancer risk is that everyone has to eat. We don't have a choice necessarily in not eating like there is with smoking. You can choose to smoke or not to smoke. But then a lot of the information and some of the papers comes out about very isolated things. And how do we start to piece together all the information about all the different components of the diet? Are there studies that are really starting to pull that all together? Kathryn, maybe you could go with that.
Yeah, I think in terms of looking at all the evidence, and I think actually probably one of the most important things is to think about, I think tobacco probably outweighs anything else actually in terms of your cancer risk. So if you smoke, it's probably a good idea to it is definitely a good idea to try and focus your efforts on trying to give up smoking. In terms of diet, I mean, yeah, there are headlines that come out, coffee is good for you, something is bad for you, and it is hard to sort of figure out, are these things just one isolated study found something that's been picked up by the media, or is it something that a lot of studies have found? I think with this World Health Organization, what they have really done is summarized all the available evidence and really concluded that there is a small increase in risk of cancer with processed meat. So I think that is probably why it's got a lot of media attention as well, because it's really looking at all the evidence together.
So, based on that, what do you think a healthy lifestyle looks like? We know that 4 out of 9 cancers are linked to preventable causes. So, what can a person do to minimize their risks of cancer, be it diet and any other factors? How do you think it all links up?
Yeah, well, I think if you smoke, definitely stop smoking. that would have a big effect on your risk of getting cancer. And even if you give up, I mean, if you give up before you're 40, you actually do still have a little bit more of a risk of cancer than someone who's never smoked, but you really do reduce your risk of getting cancer. The other thing is trying to be a healthy body weight. So if you're really overweight, that increases your risk of quite a few different cancers. If you're a woman, it increases your risk of postmenopausal breast cancer, but also other cancers, and for men as well. So yeah, I'd say smoking and trying to stopping or avoiding smoking and trying to be normal, make sure you are a normal, healthy body weight, are really 2 important things. And then in terms of diet, yeah, I would say, cutting back on processed meat, making sure you have a high fiber diet. Yeah, plenty of variety.
Yeah. So it's kind of the boring balanced diet.
Yeah.
There's no kind of superfood that's going to be.
Yeah, we always come back to that.
Bacon. No.
What I'm curious because it's coming up towards Christmas season as well. What role does alcohol play, and does it compound the issues of the red meat and bacon risks? It's aimed at both of you.
So there's been some, in terms of certain cancers, but Kathryn can also comment, in terms of certain cancers, you can find that for like, I think pancreas, drinking and smoking is bad together. So I think there are certain things, but again, I think alcohol is also a risk factor. And again, if you look at the WHO website, that really does one as a proven risk. So again, moderation.
Yeah.
Yeah.
Yeah, I would say because alcohol does increase your risk of breast cancer, and also for the cancers sort of the oral tract, you know, so sort of throat and yeah. So yeah, moderation with alcohol as well.
I think
we're killing all the fun.
Moderation doesn't necessarily kill fun. I think we're gradually running out of time now. I just wanted to ask each of you, Owen and Kathryn, if you have any final comments, any sort of closing thoughts, or maybe where you think the future of this kind of research is going to go. Perhaps we'll start with Owen.
So I think we still, as I say, it's a small relative risk, we've still really got to understand a lot better how red meat causes cancer, and I think if you then start understanding which components of it does affect and is the carcinogenic part, we can also then start putting these kind of risks into a proper context, and then we can start understanding why they do it. I think we're still, a lot of the kind of, it's not that it's pseudoscience, because there's been a lot of science behind it, but we've been very good at studying mechanisms of other processes, but as in these sort of chemo, things that affect epidemiology, things that affect sort of risk, we've probably not studied them in quite so much depth before, and I think that's one of the things that I think as a community we need to start doing.
Kathryn, where's the future for you?
Well, actually, I mean, I do work on large population studies, but I'm actually think that for the meat that I agree completely with Owen that we really need more work on the mechanisms and really need to understand what it is about the meat. So the population studies are fairly consistent in that they do tend to show that, especially when you look at them all together, that eating processed meat increases your risk of bowel cancer. But we really do need to understand what it is exactly. You know, is it the iron? Is it the nitrates, the preservatives? You know, is it cooking them at high temperatures, or is it, you know, a combination of these things? I think that will really help us. And yeah, so I think that is really important. And I think in general, looking at diet and cancer is just more of this kind of getting all the studies together, summarizing them all together, and then you do generally end up with a bit of a clearer idea about what is associated with cancer.
Thanks very much. So we have lots and lots of information about diet and cancer and risks and red and processed meat and all these kind of things on the Cancer Research UK blog and on our website. And we have been live tweeting some links to those. I hope my colleagues have been. So I'd like to say thank you very much to our guests. That's Owen Sansom from our Beatson Institute in Glasgow, Kathryn Bradbury from the University of Oxford, my colleague Bedini Sabarasinghe from Science on Google+, and I, Katani. And I would just like to say thank you very much for watching. We would love to know your ideas, our listeners, viewers, for what you would like us to discuss. We have access to some absolutely incredible experts across the UK and perhaps even further afield, talking about the latest cutting issues in cancer prevention, in cancer research, in cancer treatment. So please do drop us a message under this video. Let us know what you'd like to hear about. So thank you very much for watching, and I wish you a very pleasant evening, day. Thank you, and enjoy your bacon sandwich.
Yeah, with caution and in moderation. Thank you both for joining as well. Goodbye.
Thank you. Bye.